Hello there, I'm Dr. Pat Rabjohn, a psychiatrist here in Mansfield. We need to have a talk. We need to talk about suicide. This year in the United States, we will have close to 40,000 suicides. That comes out to 110 people killing themselves every day here in our country. So let's go through some questions here over the next few minutes and see if we can learn something about suicide. That number I mentioned, 40,000. 40,000 suicides. So question number one, will we have more deaths from breast cancer this year in our country or more deaths from suicide? There will be around 32 to 34,000 deaths from breast cancer, so we have slightly more suicides. Now, who is more likely to attempt or try suicide, males or females? Females account for about 80% of our suicide attempts. Who is more likely to die in a suicide attempt, a male or a female? Males are much more likely to die based on their chosen method. What are the most common ways that a female will attempt suicide? Females are most likely to try an overdose. Now, their second most common method tends to be hanging. What is the most common way a male will attempt suicide? Now remember, their way tends to be pretty lethal. Most male attempts are by gunshot, which means over half of our suicides in the US are by gunshot, approximately 22,000 per year. How many homicides are there in the US each year? We'll have about 16,000 homicides this year in the United States. Now, as bad as homicides are, we'll have over twice the number of suicides. Yet, we rarely hear about suicides and rarely will we talk about it. Where is the most popular place in the US to commit suicide? It's the Golden Gate Bridge in San Francisco, where we have about 40 suicides per year at the bridge. Which day of the week is the most common day to commit suicide? It's Monday. What's the most common month? Now, interestingly, most people think it's around the holidays, but for reasons we can't figure out, the most common month flip-flops between May and June. Military suicides have almost doubled in the last decade. The most common profession that dies by suicide are physicians. 4% of us doctors die by suicide. Dentists are the number 2 most common profession, followed by police at number 3. So I have 2 very important things I want to tell you about suicide. Now, all those previous facts are interesting and hopefully they got your attention, but I really want you to hear me on this. The number 1 risk factor for suicide is untreated depression. Without a doubt, our number 1 risk factor for someone taking their own life is untreated depression. So if you know someone who is sad, someone who's having a tough time, maybe it's triggered by a divorce, loss of a job, they're drinking too much, or they just don't seem the same, it's okay to ask them if they're depressed or having a difficult time. There is help available. We all have coworkers, friends, family, pastors, nurses, therapists, physicians, all of whom can help you. Our number 1 risk factor for suicide is untreated depression. The second thing I want you to think about is this. These suicidal thoughts are temporary. Think about the worst time you've had, the worst day of your life. We've all had one. It was temporary. If you've ever been suicidal, chances are you weren't the next day or the next week. So as intense as those thoughts can be, as bad as those days can be, they are temporary. It's okay to ask for help. 110 suicides a day in the US. That is far too many. Hopefully, we can find ways to discuss this topic. We can limit attempts. People can find the help they need. Thanks for listening.